Hi, welcome everybody. We are very excited to have such timely information from one of our very long-term preferred partners. Hancock Whitney has been a partner of the Emerald Coast Medical Association for 10 plus years now. And we're still putting up with Jeff Dannelly's jokes. And he provides a lot of really good support as far as resources, but also entertainment. And so we are very thankful today to talk a little bit about the evolving economics. And all of this is very timely. Steve Morgan is going to give us a presentation that'll give insight into how recent changes in policy and et cetera have affected the economics of medicine. So, Jeff, with that, I am going to turn it over to you to introduce Steve and talk about his credentials. And then, Steve, you take it from there, and I'm just going to make sure that at the end we have time for some Q&A.
Well, wonderful. Michelle, thank you. And thanks to the Medical Association. I don't know how to take some of that intro, but actually I'm pretty proud of what you said. So thank you for that. Here's what I will say. Hancock Whitney has been a big advocate and a partner, like you said, of the Emerald Coast Medical Association for over 10 years. We did it in the beginning, and man, has it been beneficial for us to hopefully provide some value and insight to the members, regardless of what that is. But it also, hopefully, I mean, it's been beneficial for us. And so we appreciate the partnership and how we have partnered with you guys over the past 10 years. You know, a lot of times, and you joke, I've been around this, the organization for a while. And still a lot of partners that are the members of the association, kind of come and saying, exactly what is Hancock Whitney or what do we do? And so we thought this slide did a really good job just to provide a little more insight. Number one, we're a local bank, right? I mean, we're here to serve our community. The picture in the bottom shows we're really kind of a Gulf South bank, but we have clients all over the country. We're a $35 billion bank when it comes to asset size. So it's not a really kind of a small operation, yet we have a local team. As each person that listens to this will know, we have local people in our market, Okaloosa, Walton Bay County, that serve a lot of the members of the association. So I think that's impactful. So it just shows our scale and our scope. On the right-hand side, and this is kind of where Steve Morgan comes into play and his team, what people a lot of times don't know is we manage or have assets under administration of over $35 billion. And actually, we just purchased a large trust and asset management company in Tampa, Florida called Sable Trust, which added roughly $3-4 billion to that number, as well as assets under management, which not only, before we were considered one of the top trust and asset management companies, the top 50 trust and asset management companies in the country. We're well under that 50 number. So top trust and asset management company in Florida. We actually have one of the most significant trust and asset management businesses for our entire footprint. So again, not that means a ton to a lot of people, but all I say is you're dealing with our local team, but you have a lot of expertise and knowledge behind what we're doing, but we're here in the community. And that's different than a lot of our competitors. So we talk about lending, we talk about deposits, we talk about those things. Yeah, I'm sorry.
Can I add a little color to that and say that, there's this idea of the 80s and 90s in terms of banking was a lot more local banking, and there was some handshake deals. There was a lot of, I know this guy, and it was a lot more friendly and local and avuncular. That is the feel I've always had when dealing with Hancock Whitney, is that it's a local bank feel, kind of maybe calling to some yesteryear, some good old days. It's very lovely to see all this nice data that you have here, suggesting, there's some brains behind that kind of local feel, but the feel whenever I talk with any of your bankers is that, they know me and that they're friendly, and these handshakes really mean things, as opposed to perhaps some of the larger banks that you may hear about.
I got to put you on payroll. So just be on the lookout. No, but we appreciate that. And actually, that's what we try to do, right? When we're at the CME event in January, and we have a table, and we have our employees there that are talking about how we lend to people and how those are the relationships. Then it's our job to bring in people like Steve Morgan who do what they do and they do it so well and they manage a team that brings significant credibility to a much more complex clientele. So thank you for that, because we strive ourselves to say we are local bankers, even though we have that. So thank you for that. I really appreciate it, Doug Davis. And so with that said, done with the commercial. We talked about bringing in Steve Morgan. Steve Morgan, as you can see, when we acquired Capital One's Trust and Asset Management Company, he's one of the key senior leaders there. He's maintained and is still on our senior leadership team. And he really kind of delivers investment strategies. He works with the team, manages the team that comes up with investment strategy, but he also goes into the weeds to help us understand the complexities behind what's going on in our little world, right? And so you can see with his Bachelor of Mathematics, and Master of Mathematics, he definitely is the brains behind what we do. So I'm excited for Steve to be on. I think everyone that is on live and they'll join us and listen to this later will see it. And you have direct access to Steve and his team should you need it. So I'll pause there, and then Steve, I'll kind of let you take it over.
Hey,
Great.
Steve, before you get going,
yeah.
Steve, can I just say that I also have a Bachelor in Mathematics, so can we nerd out offline about various different things?
Yes, we're gonna sidebar that here afterwards.
Perfect.
So fantastic.
Oh wow!
And I'm happy to drive over to talk about that or anything else that we need to. So great. As I said, what we really want to do today is talk a little bit about the economics that are underlying the health industry, but that really talks about the national economy as well. So we're going to do a little bit of an overview of that. We'll drill down just a little bit into a couple places. I know people are at lunch. You're probably, or if you're watching the recording, doing something else while you're doing it. So we want to give you a little bit of a taste, hit on some highlights, and then if there are particular issues, we'll have questions and answer, or you can follow up with any of us at the end. And of course, unsurprisingly, inflation has been the headline story for the past several years. Blue line here is the core CPI. It is the sort of real measure of inflation that most people pay attention to, although it leaves out food and energy, which are kind of important in my view. But wanted to layer in also two other of the subcomponents of that. The medical services, really what probably most of you are involved in. What does that inflation look like? And then the medical commodities, and here we're thinking about things like equipment and pharmaceuticals and so forth. And you'll notice that green line, the commodities really have been drawing the overall inflation rate down. They've been helping us out. Meanwhile, the services have been sort of along the lines. We see it spiking up here in 2022, I think, as everybody was dealing with trying to figure out how to get people into their offices to serve the clients that are there, or into the hospitals. Then after that surge, of course, it fell off, and it's been sort of normalized back to what we might expect. But that's been the story so far. And now we're going to take a look and see, okay, where do we go from here? Well, that discussion about the getting people into the office to sit in the seats, to walk the hallways is really kind of tied to what happened in the overall economy. And for about 3 years, Jeff will tell you, I said this was the most important thing, the slide that I showed, the most important graph that we had. This blue line here is the essentially people, the job openings. Think about the classified ads, the number of positions that were unfilled that people were still looking to fill. And the red line are the number of people out there actually looking for work. And of course, that spiked up as everybody got sent home during the COVID shutdown. But what we see is those crossed over. And for a while, we had this very unusual situation where there were lots and lots of job openings and not too many people to fill them. Those have normalized a little bit. This gave us a huge cushion so that we didn't see a big economic slowdown. But now those are normalized, and that's not the cushion that it used to be. And in fact, we are seeing a little bit of an uptick here in that job openings number versus the people looking for work, but it still feels like there are items there. And we're going to be watching to see exactly what happens with a couple of the other policies that are being implemented in Washington that may have some impact on that. But so far, the story has been one with some pretty good feelings at the end. Our GDP has been showing growth. This goes back, kind of gets rid of the 2020 weirdness around COVID, but still some of the recovery happening in 2021. We got a little bit of a negative here, but these numbers have been hovering 3 and 4%. Those are remarkably good numbers for the U.S. economy. It's a large economy in the world. It is the very diversified economy. The fact that it's able to grow at this pace has been remarkable, but we did see a little bit of a pullback at the beginning of 2025, just a little bit, only with modifications. It was originally reported as about a 0.3% shrinkage in our GDP. That's been up to about a 0.5%, but that's still tiny, barely perceptible as we went through. And there are some particular things that are driving that, but we've also seen, as that's happening, that consumers may be are now the thing to watch and may be starting to pull back. We just saw in May kind of a drop off. These are the monthly personal consumption year-over-year changes that have been going on since 2023. Red line here is just the average. And it was starting to trend down a little bit and then came back up at the beginning of the year. But after the tariff announcement, we saw it drop off. And that's been the sort of new sheriff and the new story in town. Now, anything that I could possibly have put together has probably changed even while we've been on the 10 minutes of this. And certainly by the time you see the recording, it will have changed again. Just last night or yesterday, we got a 50% declaration against Brazil. We have copper that has come in online recently. And we have information, by the way, about pharmaceutical tariffs that may be forthcoming. Now, I just want to point out, this goes back to about 1860s, and we had some pretty high tariffs in the early days of the Republic and the late 18th century. Really, tariffs were the primary source of government funding, but that dropped off as we got the income tax. It's been really remarkably low. We've been in a free trade environment for decades now, and this was a number that sort of April 15th. It was a little bit after the Liberation Day announcement. We had gotten sort of the mutual trade war exchanges going back and forth with China. So mid-month, estimates were up somewhere north of 25%, so 27, 28% of what the effective tariff rate would be. That's up from about a 2 or 2.5% effective rate in the years that were leading up to that. So that's a huge change in the way that we would look at international trade and the way that things will flow back and forth. A lot of medical supplies have so far been exempted, but that may not be the case as we go forward. We're going to continue to watch this as we see some of the pullback on China and some other things. This may end up at something like a 15 to 20% number, but that's still a nearly 10% or 10% type of change, or 10 times type of change in what's happening. So it is a major shift in the way not only the U.S. economy works, but the way that the global economy works, because the U.S. consumer is the driver not only of the U.S. economy, but also in many ways of the world economy as well. So as I take a look here, what does that mean? Well, the per capita personal health care spending, and this this takes out things like government administration. It doesn't include that. It does not include some of the infrastructure build out. This is sort of what people, insurance companies, and the government are spending on the delivery of personal health care services, to include equipment that's being supplied, pharmaceuticals, as well as doctors' visits. And we saw, unsurprisingly, in 2020, there was a big jump here in the amount that was being spent per capita. It was over a 10% jump. But notice, this is the average over the last 25-ish, well, this goes to 2023. Over a 23-year period, was about 5%. I'll point out that that is faster than inflation, and so and generally faster, even putting that together with GDP growth. That means that this is an expanding part of our economy. What does it imply as we look forward here? Well, there are a couple of things that we want to bear in mind, a couple of policies that are looking out there. And the first is that, as I said, pharmaceutical tariff possibility that is going to potentially have a real impact on the cost of prescription and non-prescription medicine. Figures are a little bit hard to parse out because we get values at the import on the sort of wholesale good, and then it doesn't include the distribution costs and so forth. But let's call it roughly 40% of the total value of pharmaceuticals sold in the U.S. is imported, which means that if we are starting to put a tariff of something up to 200% tariffs on some of these goods, which the president just said in the last couple of days, he's looking at 150, 200% tariffs. So essentially tripling the cost on some of those imports. And if we include some of the active components, that number is probably even higher. It's probably a 50 or 60% of the pharmaceuticals that are coming in. You multiply a 60% component times 3 times, you've suddenly got a significant increase. Now, there are a couple of offsets. One thing that has not been discussed for a while that was important at a couple of locations is, remember, beginning of next year, we do see the first round of medicines that were negotiated through the Medicare, Medicaid services. We have another round that should come on in 2027. We're in the midst of those. I think the final interviews going back and forth end October 31st. So we're going to see a lot going on there that will help control some of those costs, but a tariff will really potentially blow that up. And it is hard, by the way, to bring production online rapidly. Now, the president said those probably won't go into effect for a year to a year and a half if he declares them, which does give us some time. And we've already seen something like $50 billion in short order of distribution and research being onshore to the U.S. within a few weeks of sort of the inauguration. But it's worth noting that it's going to take a lot more to get there. So look to that to be a problem, and that's going to be potentially a way on consumers as they make choices about their health care and what they're going to pursue and what they're not. Now, the reconciliation bill, and I will say right up front, we are still getting some analysis in. We don't have all the latest CBO research. We don't have a lot going on, but it is worth noting. Now, this first little bit are 10-year amounts, but again, Centers for Medicare, Medicaid. If we just look at how much Medicaid is spending, it's been north of 18% of the total spend on, again, personal health care. That's in there. So if we see a big restriction on that, remember the Senate actually cut more deeply than the House. It's about a $920 billion cut over a 10-year period into the Medicaid. They also, by the way, created a cut in the food SNAP program, which has some follow-on effects for health concerns. There are some other items. There's some changes in the ACA and the sort of expanded coverage, the funding that's available there, additional work requirements for the Medicaid, Medicare. All told, the CBO before the Senate version was estimating something like 16 million people that would lose their health insurance entirely. And obviously a lot of that could be in the kind of locations near us. I'm sure that a lot of your folks are dealing with patients that private insurance or self-funded that don't have to worry about that as much, but it's going to be a real drain on some of the resources that may be there. Now, there is that $50 billion rural health or rural hospital support program that's in place. The KFF, formerly I guess the Kaiser Family Foundation that does healthcare analysis, estimates that the total hit here, and again, this is probably a little bit of an underestimate given the Senate version, estimates it's about $155 billion loss to rural hospitals over a 10-year period. We only have 50 billion, and that, remember, is only a 5-year. Now you can see that they might well send that out, but the federal deficit's growing, and it's going to be harder and harder 5 years from now to continue to expand that. So I would definitely be taking a look at looking for, we're looking for ways that hospitals are going to, and private practices are going to expand, take on efficiencies, look for ways to get support. There may be some additional consolidation in the industry overall that is going to be driven by some of the needs of just making sure that there's other sorts of support available for some of those hospitals. Now, that cost of money has gone up. It used to be that we were, the Fed rate was essentially zero as we came out of COVID, and even 10-year rates here were below 1. It was cheap. That meant that mergers and acquisitions were easy. Private equity was easy to fund because they could borrow at pretty low rates. That's come up, and we've seen a real drop-off in some of that private equity activity, coupled with some scrutiny from states that have discouraged some of the private practice sort of management platforms that are typically the way that private equity acquires, particularly physicians' practices. This looks to be a trend that could potentially, we're really watching here, looking to see if it reverses as things drop off. But at least it's stabilized, and what we're expecting is to see some additional activity, either, again, from a private equity acquisition of practices and possibly even hospitals, but also larger hospital chains going out and acquiring assets and bringing telehealth and other kind of flexibility out into other communities that may not be as deeply served. So sort of good news if you're looking to potentially sell is that those are coming along. Bad news, of course, is that if you're not looking to sell, it's going to be harder to find the funds to continue your practice. With that, again, we have lots of other ways to kind of keep up, but let me pause and see what questions or comments people might have. Tell me where I'm wrong. It's been known to happen more times than I care to admit. The market always reminds me of that. So let me pause.
Yes, Steve. I would say that, well, I often say that I've been wrong before. Just ask my wife, she'll tell you. But either way, so there's a lot going on here and a lot that we don't really think about on the macroeconomic level. This is why we have professionals like you that can talk to us about this kind of stuff, which is really great. It seems like, and I'm kind of a big picture guy, it seems like the private practice physician is getting squeezed here. Is that an accurate representation?
I think that is very much an accurate representation of where it is, right? The support that you might have otherwise gotten is not there or is being diminished. At the same time, costs are going to be going up. You may not have the same negotiating power. And importantly, there are two items that are happening as a result of deportation. Now, generally speaking, healthcare is not at the top range of sort of undocumented workers that are participating, although I suspect there's probably more in the sort of close by industries. It's really construction and agriculture, which we think of and generally speaking is true. But as if we go through and see large scale deportations, one of the things that will happen is that will make workers scarcer and it will make them more expensive. On the flip side, there's also some demand destruction. There'll be fewer people that may be walking into your office that may be paying through their company insurance or through their just sort of payment. But generally speaking, that's also true of all the other industries that you can think of that serve consumers. And so that's something that we're really trying to get a handle on, that personal consumption expenditure. Some of that is from consumers digging in. Some of it's probably from consumers that are self-deporting already. We've seen a large range of maybe some of the Venezuelan people that came in under sort of amnesty and were had some parole to go to work, have started to go to Canada, to Europe, and elsewhere. And so in particular locations, we're seeing that already start to manifest itself.
So let me ask you a slightly different question here. In the business world, and I'm going to start talking way out of my league, way over my skis here for a second, but in the business world, we've had the Magnificent Seven. And now there's some thought that perhaps the Magnificent 493 may start to fill in that gap that had long since been driven by these seven mega companies. Is there an analogy with the major healthcare markets, Ascension, HCA, those mega hospital corporations, that they're going to start to fall off, and maybe the private business equity will start to fill in that gap? Because if you're going to squeeze the smaller businesses, at some point, this whole thing's going to collapse. And I don't think that's better for our country and the world.
No, so I think that there are a couple of things, and you're exactly right. We do expect some of the rest of the S&P 500 to benefit from that. Now, the notion that will accrue all the way downstream is a little less clear. I would expect that the next round may actually be some of the larger healthcare providers, as they go through consolidation, have an opportunity to do acquisitions and expand kind of market share at the same time that they may be in a better position to control some of their costs. After that stage, however, then we see a place where probably there's going to be a government response because of an increasing dearth, if that's a thing, right? A diminished presence of viable healthcare in a lot of locations, even affluent locations that just may not be close to a population center that would tend to attract sort of those larger scale operations. And so I think we'll see that in the same way that we saw eventually internet, for example, make it out into rural locations. And this is obviously a little bit as or more urgent than that.
Yeah, we try and focus here on our local medical society, our local medical community here, about the things that we can do for that. And I certainly think that there's some big business principles that I try and talk with my management team all the time about how can we bring some efficiencies that maybe we can learn from some of these other facilities into our own practice. But ultimately, I don't think the customers, which are the patients in this case, I don't think they want more big healthcare entities. Now, I may be way off with my finger on the pulse there, and ultimately, I think those customers are the taxpayers. And so I think they will have an eventual voice here that says, we don't want more soulless, gigantic corporate feed through industrial farms when you go into them. We want more we want to see our doctors. And that's one of the things that we're really banking on here, not only with our own business, but hoping in our medical community here in the Emerald Coast Medical Association that we can pop up to support our physicians and say, let's treat our patients the way that we want to, and eventually that will pay off. I hope you're not telling me something different, is what I'm trying to say out of that.
No, I'm not. In fact, there is a counterbalancing force here around sort of the emergence of AI, et cetera. And obviously there's a lot of noise being made around the potential effects of that. And 10 years from now is way too far out for me to project what that's going to look like. But what I will say is it does allow smaller practices to implement some of the things that larger practices do without, sort of the same kind of cost structure that you would have faced without it. And so I think that there are opportunities. And we started out, you mentioned the sort of local banker presence. I think you're right that there is going to be, as people deal more and more with the machine, a higher desire to make sure that, your doctor knows you and that you feel like you can take some time, share with them, and then you'll see them the next time, and they will have that relationship and know exactly what's happening. I think that's really going to be at a premium, but there are going to be some of these economic forces that you have to navigate through, and it's going to take a little while for consumers to be willing to pay up for it. They'll get there, but if we see an inflationary period around tariffs and other things, it's going to be a little bit of a pullback, we think, until they can start to be willing to go back and ask for additional support from the government or to provide themselves.
Well, it's really nice to hear an expert talk about these kind of things and use words that I mostly understand. Now, I don't want to derail you too much from any further talking points that you have, though I certainly could bring up some other points that we have in our own personal practice. And I think in the local community, maybe even at the state level, about how insurance is going to react to this and how they are participating in the squeeze from a different end, I think.
Yep, and we are happy to dig in a little bit more, and we'll even bring out a couple other people that spend some time on our team thinking about it. So at any point, just let us know, and we'll make it over and sit down and talk through. It's one of my favorite things is to talk with some of our business clients about kind of what the economic effects might be on their industry. It requires me to think about things from a new perspective.
Yeah.
All right, Jeff.
Let me just bring one more thing up, just because I've got you here, and that is, and maybe you don't have an answer for this, but from the insurance perspective now, there's talk of CMS making prior authorization a thing that typically has been done from private insurance companies, and that would push the burden back more onto practices, just in terms of our timeshare of employees that are doing that kind of work. I didn't know if you had any thoughts on that and maybe how we could approach that.
You know, that we do not. I don't think we have a clear idea of exactly what that was going to look like if it is implemented. You know, obviously that's an increased administrative cost, as not only for you, but for the government as well. And so I think there's going to be a little bit of a hesitance to increase the bureaucracy. On the flip side of that, government is not necessarily afraid to impose some requirements without funding the things. We've already seen on the energy side, some of the mineral licenses that nobody could actually provide. So there were suddenly a lot more licenses available, but nobody to review the applications. So I'd expect some noise in the short term, and then probably a backing off. That sort of deregulatory impulse is probably something that's going to be in place for a while, if for no other reason than it's a budgetary aid to help with the deficit.
Well, I will save you from asking about the Riemann zeta function. That'll be something we do offline. Okay, so
fair enough.
Steve,
excellent. We will talk manifolds and everything else. So
beautiful.
With that,
thank you. Finally.
Awesome. Steve, real quick, when you spoke about the Medicaid numbers and the impact of those that would be losing insurance, et cetera, my question is, I thought there was a component to this that would be a state opt-in or opt-out. And so have you had a chance to look at how that could be different across different states? I think if I understood you correctly, you were speaking globally.
So I am, and I can come back and give a little bit more data around that, because there are some state figures that are available. They haven't yet been updated to reflect the latest version. So let's give that a few more days, and I'll make a mark on my calendar and come back with maybe some better analysis there if we get some updates.
Okay, and I think maybe Andre with Dr. Aga's office was asking too, you know, if there's a prediction that commercial and self-insurance plan premiums would increase because private payers that manage Medicaid plans will be losing lots of money. So I think we have lots of insurance related deep dive questions. I'm not sure if you're able to answer this right now for us, Steve, or if this is something that we should do a follow-up. We could even do it as a white paper, you know, and send it out as an e-blast with kind of an answer to some of these questions and an update, if you would be willing to do that. And so I'll let you answer if you can, you know, speak to this right now, or if this is something you want to follow up.
Sure, and if I am sensing some backlog of questions, so tell you what, why don't we plan on doing a follow-up, and I'm happy to do it as in both formats, either both as a Zoom and then as a sort of blast out, so that people have that, and that way we can also do that, you know, in a week when we have some better analysis from some of the investment banks and consultants that spend a lot of time picking apart, for example, insurance responses, and we will put that together. So if you want to send over that list of questions,
Okay.
just especially in terms of getting people back from their lunches, or let them turn off the machine and get back to the beach, we'll do that as well.
Okay. We'll hang on to these, Andre, then, and we will follow up and get some good answers for this. Thank you so much. Jeff,
Yeah.
do you?
Yeah, just a couple of quick things. First of all, this was the free version, so the next time we do it, we charge by participant. But because we're a great partner and we love the Medical Association, we're going to do, no, of course, just kidding. We are excited to help any way we can. What were we going to say, Dr. Davis?
Jeff, you're so magnanimous. We really appreciate that. That's.
I'm here for you. I'm here for you. But here's the last part, and then I'll wrap up my part and then turn it back over to you guys. But what Steve and his team do, we do for a lot of our business owners, our high net worth clients, institutions, trust, pensions, et cetera. But it's not just in this format. So just know, and we open this up to the Medical Association. We have weekly emails that we send out covering kind of the key pieces. I say I don't do any of it. Steve and his team does. Quarterly summaries, you can see that. We do monthly webinars where Steve and the rest of the team from our senior leadership provide just an amazing amount of information. And then we do some special, one-offs whenever stuff happens, which it happens more often than not. So we welcome anyone that's listening to this. If you are interested in being part of that, we're happy to add you to that list. It is really a lot of great information, especially if you like to get into the weeds sometimes, because Steve and his team love to go into detail. And that's what we love, because we have that as a resource. So that's number one. That's what we have. We meaning the Medical Association and all the members have access to. I'll bring it back kind of to our local team. And all I would say is I speak for Ben Lee, the market president, and the rest of the folks that a lot of people that are going to listen to this understand, remember we do it all, right? Not only we have access to this type of significant brain power and ability to help our clients with complex estate planning and financial planning and insurance needs and business succession and transition. We do it all. We're also the bank, right? We're here to help with, you need banking relationship and banking accounts for you and your employees. Do you need a loan to expand your business? Do you need to buy a piece of commercial property to put your business? We have significant programs in place now to help with that. So even though you might find us talking more about the investment management, estate planning, financial planning, and private banking, just as a reminder, you can come to us with whatever you need financially, and we're going to find the right person on the team to help you. So that's my 30-second commercial. That was more than 30 seconds, but we appreciate this opportunity. And just to reiterate, we love the 10+ year relationship we have with the Medical Association, and appreciate everyone that's listening to this. So I'll pause and I'll turn it back over to you guys.
Well, Jeff, we are not going to charge you extra for that extra time. We just appreciate your stalwart confidence in our community and vice versa, the relationship that we've established there. Seriously appreciate your insight here. Both of you, Steve, thank you very much for bringing all this intellectual power and explaining it in a really digestible way. Jeff, thank you as always. Ben, thank you for being here, even though you're scared to put your picture up here. We really appreciate you guys and all your support here, okay?
And it will be available by recording. There he is. Hey, Ben, you're muted, but we see you.
Ben, you're muted, but that's on me. I messed up with the link. My bad, Ben.
I didn't want to go too far, Jeff. I didn't.
All right. Well, thank you very much. I'm going to go ahead and stop the recording.